57-year-old Chinese national residing with her daughter in Australia, tragically passed away after following the advice of practitioner Yun Sen Luo to discontinue all Western medicine. This case underscores a critical intersection of traditional healing practices and modern medical care, highlighting the potential dangers of rejecting established medical interventions. On January 30th, the New South Wales Civil and Administrative Tribunal found Luo guilty of unsatisfactory professional conduct and professional misconduct following a prosecution brought by the Health Care Complaints Commission. While the outcome of this specific case focuses on professional negligence, it prompts a broader discussion about the responsible integration of complementary and alternative medicine, CAM, within a healthcare system predominantly reliant on evidence-based Western practices. The tribunal's decision is significant in its acknowledgement of a preceding criminal trial. In that 11-day proceeding, Judge John Pickering acquitted Luo of manslaughter charges. This distinction is crucial. The criminal trial focused on proving criminal culpability, a far higher burden of proof than the professional misconduct case before the tribunal. The tribunal's verdict does not suggest Luo directly caused the woman's death, but rather that his professional conduct fell significantly below acceptable standards. This distinction highlights the legal complexities surrounding cases involving CAM and patient outcomes. The lack of manslaughter conviction doesn't negate the seriousness of the professional misconduct, which centered on Luo's alleged negligence in failing to acknowledge and integrate established medical evidence into his treatment plan. The woman's decision to forego Western medicine, influenced by Luo's advice, ultimately proved fatal. The case has sparked considerable debate regarding the appropriate integration of traditional Chinese medicine, TCM, and other CAM therapies within the Australian healthcare system. Professor John Wardle, convener of the Public Health Association's Complementary Medicine Special Interest Group, offered a nuanced perspective. He affirmed that traditional knowledge holds legitimate value and practitioners are entitled to utilize it in their practice. However, he emphatically stressed that practitioners cannot disregard other forms of reasonably established evidence. This statement underscores a central tenet of responsible healthcare practice: the integration of traditional knowledge with scientifically validated medical understanding. The ethical responsibility of CAM practitioners lies in informing patients of potential risks and limitations associated with rejecting evidence-based Western medical treatments, especially in situations where such treatments may be life-saving. A practitioner's professional duty involves a comprehensive assessment of the patient's condition, considering all available evidence, and providing informed consent that clearly outlines the potential consequences of different treatment. This case serves as a cautionary tale, highlighting the precarious balance between respecting diverse medical traditions and ensuring patient safety. The need for clear guidelines and robust regulatory frameworks governing the practice of CAM, ensuring transparency, informed consent, and appropriate integration with established medical care becomes undeniably apparent. The tragic outcome reinforces the critical importance of open communication, shared decision-making, and a holistic approach to healthcare that acknowledges both the potential benefits and inherent risks associated with all treatment modalities. The legal proceedings, although concluding with an acquittal on manslaughter, have undeniably raised important questions regarding the ethical obligations and professional responsibilities of practitioners who integrate CAM with Western medicine, urging for ongoing dialogue and improvements in regulatory frameworks to prevent similar tragedies in the future.